Changemakers are Irish university researchers who are helping to shape our future with groundbreaking projects. They're committed to finding solutions to society's most complex challenges by working closely with some of the people who will benefit most. Welcome to Changemakers. Changemakers from Irish universities are improving the lives of our children, from their earliest days in the womb to their early years of young adulthood. Later we will meet the researchers who are helping to amplify the voices of Ireland's children and discover what matters most to our young people. We meet a class who are using gaming to beat maths anxiety, a common condition in our school population. And we visit Nafina GAA Club, who are valuable collaborators on a research project that aims to have our children moving well and being well.
Other foot, and go!
Over 55,000 babies are born in Ireland each year. For many mothers, pregnancy is a wonderful experience. But for 1 in every 10 pregnancies, however, mothers are affected by preeclampsia, a condition with serious and potentially life-threatening consequences for both mother and baby. For babies born prematurely as a result of the condition, there can be far-reaching issues in terms of development. Over 14 years ago, Aoife and Simon Owens from Dublin were delighted with the news of Aoife's first pregnancy. Aoife and Simon were mindful of possible complications, but at 9 weeks, their doctor informed Aoife that she had preeclampsia.
That's when preeclampsia first came up as a term that I'd never heard of before. But it was highlighted to me that it was high blood pressure in pregnancy and that it was something that really was more than likely going to affect me later on in the pregnancy. Preeclampsia, it's very scary. It is very scary. It's probably one of the few conditions that you can have high blood pressure in pregnancy. It doesn't just affect you, it affects the baby. My consultant was absolutely fantastic. She said from the word go, he is going to be early. This is a very touch and go pregnancy. It could go either way.
Changemaker Patricia MAGUIRE has been investigating the area of preeclampsia from her lab at University College Dublin, looking particularly at the important role that blood platelets play in the condition.
So we all learned in school that platelets clot your blood, but they do so much more, okay? So when they're circulating around in our blood, they're constantly taking in information, and actually really vital, important information about the state of our health. So they're almost like little health sensors in our blood. And so what we found over a number of years of doing that, we collected enough samples to find out what were the differences in preeclampsia. So we used our knowledge of the platelet to understand what were the differences. What's the signature of preeclampsia? And we found that out.
Professor MAGUIRE and her team at UCD worked closely with haematologists, consultants and patients from Ireland's maternity hospitals in order to gain more insight into the condition.
So what we do is we get the blood from the people and patients suspected with preeclampsia. And what we do is we analyse this blood to find the unique signature previously we have identified from platelets that tells us about preeclampsia. It's a specific preeclampsia signature that we can analyse and combine with other health and data about the patient to create a very detailed snapshot of the health status of preeclampsia patient.
Diseases like preeclampsia are so complex that a blood test alone may not give the answer every time. So you need to combine lots of information together with the blood test. And that's the basis of our AI PREMIE test, is this signature that's different in preeclampsia. And what we're doing is we're combining that signature with all the other information that's collected from the hospital, from blood tests, from urine analysis, even from what the clinician thinks and patient history. And we're combining all of this together with artificial intelligence, all in the cloud, and being able to then deliver all of that information back to the clinician.
Isn't it? Is that your hand or my hand? That's your hand.
Yeah, that's my hand.
With her early diagnosis, Aoife was preparing for an early delivery, knowing that every week in the womb counted for her baby. For consultants, sometimes the diagnosis of the condition isn't as straightforward.
What AI PREMIE will do for them is, one, it will help them understand if that woman has preeclampsia. But the game-changing bit is, it will also help them understand how severe that preeclampsia will get.
At 29 weeks, 11 weeks before full term, Aoife was given unwelcome news.
My obstetrician came in shortly afterwards to say that that was it. They couldn't push me anymore and they couldn't push the baby anymore. We'd gone as far as we could, and that was at 29 weeks and 3 days.
Reese was born at 2 pounds 8 ounces. After spending 3 weeks in the high dependency unit, he was soon allowed home.
Reese now is 14, in second year in school, and he's a great kid. We're so proud of him. He's a real sensitive and kind and warm young man, and we couldn't ask for more. We're just steeped with him, steeped.
We're bringing the blood samples back to the lab from the hospital environment right now. But the dream is to be able to have AI PREMIE as part of standard blood tests in hospitals for pregnant women. And what the dream is that we can get this into every maternity hospital around the world. And we want to have a machine that can use the AI PREMIE test to analyse that mother's blood and then combine that with all the other information about the woman and about that baby so that it can literally pop up on the computer screen of the clinician in real time.
Patricia and her multidisciplinary team of researchers, consultants and patients are now collaborating to fight the condition of preeclampsia, not just in Ireland, but across the globe.
And using the data analysis, I suppose, to actually figure out the differences. Is that it? If I can help one baby stay inside in the womb for one more week, I can make a massive difference to their life.
We all dream about having, the perfect pregnancy and, perfect nursery and, all that kind of thing, but some people just aren't that lucky. So research in this area is huge, and it would be great if there was just a better way to spot it earlier.
For over 25 years, researchers in NUI Galway have been recording and charting the lives of Ireland's children and young people. The Health Behaviour in School-Aged Children study is headed up by changemaker Saoirse McGowan.
Our team at NUI Galway focuses on children's health and well-being. Children have the right to be involved in decisions about their lives, according to Irish national policy, but also the UN Declaration of Human Rights for Children. So we include them in every aspect of our research, from making decisions about the kinds of things we research, right through to policy and practice, and ultimately improving their lives.
The team is bringing together groups of school children from all over Galway as part of Europe's largest survey of children in 2022.
What we're hoping to do with you is to set some priorities for what kinds of questions and what kinds of issues we should be asking young people in Ireland about.
Ruth, Alva and Aisling are students of the local Salerno Secondary School, Salthill, Galway.
Well, we think these ones are the most important.
Yeah, like eating and dieting is very important for
especially
us
this
anyways.
day and age.
With like social media and stuff. So we think that's very important.
And mental health and well-being because
that's like everything kind of.
And like school is a big part of our lives.
Yeah, school's massive. Like it's like a main part of our lives at the moment.
Well, there's a whole range of different issues. One is COVID, I guess unsurprisingly because of the time. One issue that's come up is environmental health and the health of the planet. One is about health literacy and how young people use information. So a whole range of different things are being included, 17 different topics. Whatever you think is important, you put a red dot beside it, and if you think it's really, really important, you put more red dots beside it. It's kind of exciting, I can't see them. I'm just dying to see what's on them. No. Okay.
You know, it's their right to be involved because it's actually going to impact practice and impact policy in Ireland. So children should have a right to be involved in that because it will affect them. And so together with them and then the researchers, we can make a much better research study and have therefore, I think, better outcomes for young people today, but also in the future. So it impacts both what's happening in practice, so that might be in schools, but also policy, so it'll be fed back to the government as well.
Yeah, there's been a lot of changes since the mid-90s, to be fair. So in terms of children's behaviours, they're really improved in a lot of areas. So much less smoking, much less drinking. Relationships are much better with parents than they used to be. Same with school. There's more places for them to go and play, to have recreation. So life has changed for the good for most young people. And there's some areas that haven't improved, and it hasn't been an equal improvement for all children. So there's a fear about some children being left behind. What does it say?
Health literacy and eating and diet.
Okay,
yeah. Hang on.
Yeah, I think because like we're children and like we have, like the adults might think something different. Like these people the adults were saying that they didn't think things that we put up like first would be important to us, but they were. So it was good that we kind of had an input on that.
And she was saying like she wouldn't have picked them, which is good that we had the input because now we picked them and now they might be in the survey and it could help some other kids as well.
Their number one was mental health and their number two was school. They were almost equal. It's very hard to look into the future, but in terms of driving the change, I think we need to put children right in the middle and to the front of making that change. More researchers, more policymakers need to listen to what children have got to say, really genuinely involve them in decision making, but also involve them in the process of rolling out change. That's the way we're going to improve things for young people and children in Ireland. I think this work is life-changing, but it's life-changing not at the level of the individual person or the individual young person. It changes the settings where they live, where they learn, where they love, where they laugh, where we live our lives. That's the home, the community, and so on. And that creates greater opportunities, more equality, and so on for young people to explore who they are and develop themselves.
Some kids really love numbers and they love challenging themselves and they love maths, and then other kids, it can be quite a negative experience because they can become very overwhelmed by maths. So I think the most important thing is try and make it a positive experience.
The 5th class of St Anne's Primary School in Fettercairn in Dublin are playing games in the classroom to help us understand more about students' fear of mathematics.
Oh, this is the next one.
Can you remember what you have to do? You have to capture the red cards using your own card. Now, let's do a game together, okay?
Changemaker Pierpaolo Dondio from Technological University Dublin is the creator of Happy Maths, which aims to develop educational games to target the effects of maths anxiety in school children.
I think that Happy Maths has the potential to change lives in the sense that it can reduce the negative attitude towards mathematics that many children have. So math anxiety is a recognized condition and is the fear of mathematics. It's a widespread condition. There are an estimate of 150,000 students in Ireland suffering from this condition. Because it's not about being bad at math. It's not about low performance, because there are very good students, top performing students, that are suffering from math anxiety. And our goal is to try to make games that are inclusive for everybody, that they can teach maths, but they can also teach maths to everybody. to kids that are good at math, but also weak students or students with suffering from anxiety.
I like maths because I like adding and subtraction and like all them type of stuff. So you are the red and the other people are the blue. So you can go against your friends or a computer person or yourself. And you have to like, if you have the same number as them, then you can take it like that. But if you want to like use them cards, then you need to know your times, your tables, your division, your subtraction, all them type of things.
And that's your goal, is it?
The game can trigger imagination, competition, social interaction.
It can be a bit difficult sometimes when you're playing against somebody and stuff like that, but it's a nice game, it's a fun game. It helps you learn maths and stuff like that, because I'm not the best in the class. But
do you think you're getting better?
Kind of. She is, a small bit.
One of the key design of our games to promote peer learning, collaboration, is not trivial, because there are a lot of educational games around that are not doing that. There is a lot of strategy involved, but there is also a lot of play versus another player, the social interaction. So they just feel they are playing. They are not feeling they are doing math, but actually they are learning.
We try to understand what's the impact of the game on their math anxiety levels, so we measure it before and after playing the game. We also look at what elements of game design can support these children. So some children maybe will prefer to play the game on their own. Some other children will prefer to play with another child. So the more we look at those aspects, the more personalized the game can be.
Well, there are many stereotypes around. First, there is the idea that boys are better at video games, and then boys are better at mathematics. But in our study, we didn't see any of those two things. Actually, girls are performing very well. Today, a girl won the competition. Red Pony, what are you doing?
It's been such a positive experience, and the children just loved when we were doing this as our maths lesson. Obviously, we did our normal maths lessons during the week, but they always looked forward for the day that they were going to do the games on the iPad.
There is a real science and research, but there is also applied research, and then there is the social aspect. So all these elements, they come together to create something special that can have an application and an impact on society. And we are monitoring them for the 6-7 weeks of the Happy Maths project, and we are seeing some pattern of improvement.
11. Divide 3 by their 15.
Oscar, you wait till I say go the second time, okay?
Games of a more physical nature are the concern of Changemaker, Stephen Behan and the Moving Well Being Well team from Dublin City University, who are working with schools and GAA clubs in Dublin.
So we're here with our 2016 girls, okay, so these are our youngest girls here in the nursery. We've got jumping, we've got catching, we've got skipping, we've got hopping. We real focus on the fundamental movement skills. So that's again these basic building blocks. We don't go too sport specific at this age. We just really try to get the focus on the basic movements. And the idea being we get the basic movements, everyone's having fun, you can see lots of smiling faces around the place. And when the kids are having fun, first they're going to come back, and then we can layer those more sport specific skills as they go through, which hopefully their sporting life here in Nafina.
Children with poor basic movement skills are more likely to drop out of sports and other physical activities due to a lack of confidence and motivation, which could have long-term health impacts. The team at DCU wanted to survey this concept at a nationwide level.
In walked Stephen, with a great idea, with a great background in the area of Gaelic games and movement. And this idea of saying, well, how do we target them at this age? We know there's a problem. Let's look at the depth of that problem. Let's do a national surveillance and find out how that problem plays out between genders across age, and then develop a targeted intervention that eventually became Moving Well Being Well.
Morning, Stephen. Hi, Dad. How are you? How did that last capture go?
One of the partners of the survey of over 2,000 children was Noel O'Connor from the Insight Research Centre at DCU.
The beauty of this project is we're taking children's data and putting it to work for them, for their benefit, for the good of their health. And that, I think, is hugely important when we think about big data, that we put it to work for the people who own that data, who can derive real societal benefit from that data.
The results are disappointing, but they weren't a surprise. We found that 75% of those 2,500 kids had mastered the skill of running. Okay, now when I say mastered, it means they can do it 90% of the time perfectly. And you might be thinking, well, 75% is not bad, but that means 25%, so 1 in 4 kids can't run properly. So now start thinking about how many activities will they feel maybe not that confident to take part in or preclude from. And all of a sudden you can see then, if you look through all those 16 skills, all of a sudden you can see all the different activities that the Irish children may not want to take part in.
Stephen turned to schools and his local GAA club, Na Fianna, who embedded the Moving Well, Being Well programme into their academy.
There's huge hope there, because even from the small windows of intervention that Stephen has done with the kids, doing 4 or 6 weeks of this basic training with them and trying to work on those basic motor skills, you can see huge improvements. So it's actually very doable to get better quick. It's just a matter of will, really.
All we do is we tap. This is research in action, okay? This is physical literacy embodied in all these kids here, okay? So we have the fundamental movement skills, or these basic movement skills, that's now embedded here in the nursery in the Fianna, and those kids are used to doing it, they enjoy it, they have fun doing it. So we have this cycle, they're more motivated to come back, and this cycle starts them, they obviously get better then, and all of a sudden, if we do that across a broad range of skills, all of a sudden, they're confident kids, they'll try anything, and that helps them then to be active for life.
It's been successful beyond our wildest dreams in terms of retention of children, in terms of attracting new children.
I really like doing sport. It's because it keeps you fit and healthy.
After its initial success at grassroots level in schools and at Na Fianna, the next step is to take it nationwide.
And remember what you did last time, focus.
What we need to do is find a way to get that to every child in the country, pulling together our stakeholders, and there are so many brilliant partners out there that have contributed to this, but it's pulling everyone together, getting the funding behind it and getting this to every child in the country.
Excellent, Oscar. For me, this is what it's all about. This is why I went into research, and I think the whole team feel this way. We've no interest in the research sitting on a shelf for the sake of it, and we honestly believe that it's starting to have an impact on these kids and other kids that we've helped, but we'd like to see it on a wider scale and to drive it throughout the country.
Next time on Changemakers.
We're passionate about helping our environment and keeping it sustained.
Every farm is going to have a carbon footprint going forward. To me, we're better off taking the bull by the horns and being ahead of the posse.